Hello, my name is Dr. Bonnie Heithold.
Yitwa Bonnie Heithold.
I have been a member of Christian Fellowship Church since 2007, and I am a pediatrician in the community for the past almost 10 years.
Asenga hano muri Christian Fellowship amaze kuva muri 2007 kandi ni umuganga w'abana.
Caritas asked me to join her today to talk about the coronavirus and the new COVID-19 vaccine.
Naramubwiye nti ngaho ngwino umfashe ubuzumbwira ukuntu twasobanurira abantu ibyerekeye coronavirus n'urukingo rushya.
I first want to say that I have gotten both doses of the vaccine. I got the second dose about 2 weeks ago. It made my arm sore, but it filled my heart with hope.
Ati yamaze gufata uru rukingo yafashe doze ya mbere icyumweru gishize yafashe ya kabiri kandi yumva afite ibyiringiro.
In order to understand how the COVID vaccine works, we first need a quick reminder about how our human cells work and how they are different from a virus.
Ati kugira ngo twumve iyi ndwara ya coronavirus tugomba mbere na mbere kumenya uko indemangingo zacu zikora no kumva iyi virusi ya 19.
Just like we as individuals are called to work together as the body of Christ, like it says in Romans 12:4, our own human body is made of tiny individual cells working together.
Kuko natwe twese tugomba gukorana tugakorera hamwe no mu mubiri wacu habamo uturemangingo tugomba gukorana kugira ngo tubashe kubaka umubiri wacu.
These cells make up all aspects of our body, and while some have different tasks in the heart or liver or lungs, all cells share some common traits.
Izo ndemangingo zishobora kuba ziri mu mwijima, mu mpyiko cyangwa se mu mutima, ariko zose zikora kimwe kandi zigakora akazi kazo.
So, let's imagine a human cell.
Reka twibaze rero kuri iyo ndemangingo, kuri izo ndemangingo.
A human cell looks a bit like a large ball.
Dore ukuntu indemangingo ziba zisa.
And inside of it is a smaller ball.
Hagati hakabamo kandi kantu kameze nk'umupira mutoya, munini n'umutoya.
This smaller interior ball is the nucleus.
Hariya hagati rero harimo ibintu by'amazi mbese cyangwa nucleus nyine.
This is where our genetic material or DNA lives.
Hariya niho DNA iba. Hariya mu kapira gatoya ko hagati.
The DNA stays within the nucleus.
Ati DNA iba aho ngaho nyine muri iyo nucleus.
There are other things in the bigger ball.
Ati hari n'ibindi rero biri inyuma aho ngaho mu kiriya kiziga kinini ari wo mupira munini.
But outside of the nucleus.
Nyuma y'uwo kagota kari hagati.
That keep our cells and the entire body going.
Ati ibyo rero nibyo bituma umubiri wacu wubakwa kandi ugakomeza kugira imbaraga.
These are things like mitochondria.
Ati hari ibyitwa mitochondria.
Things like lysosomes.
Ati hari ibyitwa lysosomes n'utuntu nk'utwo ngutwo turimo nyine.
Mitochondria are called the power plant of a cell.
Ati hariya niho imbaraga ziri rero hariya muri mitochondria.
Lysosomes are the cleanup crew of the cell.
Ati buriya nanone hakabaho utundi tuntu twoza hagati mu mubiri nyine turimo natwo.
And there are small things called ribosomes.
Ati ziriya zitwa ribosome.
That are the protein makers in the
ziriya rero
cells.
nizo zikora proteine arizo ndemangingo zikomeza ingingo.
Plus many more things in the larger
Ati
cell.
n'ibindi byinshi mbese bifite akamaro aho ngaho muri uriya mupira munini yashushanyije.
Right. Next, let's visualize the coronavirus.
Ati noneho reka turebe coronavirus uko isa.
Viruses are much smaller than a human cell.
Ati ko kaza ari gatoya ariko nako karemye kwa kundi.
And much simpler in design.
Ati kandi kaba koroheje mu ko kameze.
They are really just a bag full of genetic material.
Ati ni ibintu gusa bifite birimo umwanda kandi byuzuye ibindi bintu nyine imbere.
Either DNA or RNA.
Ati biba bifite RNA cyangwa se DNA nabyo.
Because they are so small and simple, they don't have the ability to make copies of themselves on their own.
ati kubera ko zidafite imbaraga ntabwo zishobora kugira ngo zigende ziyongere zonyine.
So they have to hijack a more sophisticated, advanced cell to do their dirty work.
Urumva rero zigomba kugenda zikajya gushakisha ahakomeye kugira ngo zibone uko zikora imirimo yabo iyo mibi.
A coronavirus is a little bit fancy because it has these things on the outside called spike proteins.
Ariko coronavirus yo ifite utundi tuntu two ikoze ukwayo, ifite utuntu hejuru kandi dukozwe natwo na protein n'indemangingo.
These spike proteins help the virus attach to a human cell and infect the human cell.
Ati rero turagenda tugafata ku ndemangingo z'umuntu zikaba zashyiramo umwanda.
Because these spike proteins are on the outside of the virus, this is what our immune system recognizes and attacks.
Ati rero kubera ko ziri inyuma, ubona ko buri inyuma, abasirikare baturinda nanone nabo batangira kurwana natwo.
So the immune system can see this and come and eat the virus and destroy it.
Ati rero kubera ko tuba dufite abasirikare mu mubiri kandi bafite imbaraga bashobora kuza nabo bakica kariya ka mikorobe kaba kaje ka virus.
Now, a little bit of information on how the vaccine itself works.
Ati reka rero twumve ukuntu noneho uru rukingo rukora.
The new COVID-19 vaccine from the drug makers Pfizer and Moderna are a bit different from other typical vaccines.
Ati izi nkingo za Moderna, Pfizer, izi nkingo zose zaje zifite ukuntu zitandukanye n'inkingo zari zisanzwe.
Most vaccines use either weakened, killed, or small pieces of bacteria or viruses to cause an immune response.
Ati ubundi inkingo bakoresha nyine izo mikorobe z'iyo ndwara kugira ngo babashe gukora urukingo rurwanya indwara.
This new vaccine uses mRNA or messenger RNA, which is essentially a blueprint.
Ati rero iyi vaccine uru rukingo rwo rurakoresha ibintu byitwa mRNA cyangwa se RNA, izo ngizo zikaba ari ibitandukanye byo kujyana gusa inkuru ngo ndaje.
And just like in building a house, mRNA blueprints are instructions for building things also.
Ati nkuko bubaka inzu, izi mRNA iragenda nayo ikaba izanye inkuru yo kubaka inzu.
In the body, those things that get built are proteins.
Ati ibyo bintu rero ni protein, ni ya protein imwe yubaka.
And proteins can be anything from thyroid hormones that regulate our growth and metabolism.
Ati bishobora kuba ari thyroide kuko ariho imbaraga zituruka cyangwa se mu bindi bintu bikora nko mu mubiri.
To digestive enzymes that help break down food.
Akaba ari nk'imbaraga zituruka mu bifu n'ibituma igifu gikora.
To insulin that helps bring sugar into our cells for energy.
Cyangwa se abarwara nka diabete isukari kugira ngo yongere imbaraga aho kugira ngo ibindwara.
The new COVID-19 vaccine uses mRNA to build the spike protein found on the outside of the coronavirus.
Ati rero iyi mRNA n'iyi vaccine nshyashya n'uru rukingo biraza bigakora ikintu inyuma yayo.
Now let's expand on those two images.
Ati reka turebe rero kuri ibi bintu bibiri bira.
The human cell and the virus.
Indemangingo na virus.
Let's imagine a medieval city with a towering castle in the center with tall walls.
Ati reka tutekereze ku kintu cya site yose, mbese umujyi wose, ariko hagati hakaba hari inzu ikomeye cyane ifite n'ibibambasi birebire.
Now that castle is the same as the nucleus.
Ati rero iyo nzu ikomeye ni hariya muri nucleus, hariya nyine hagati kariya kapira gatoya kari hagati.
And inside the castle is the royal family or DNA.
Ati hariya rero muri iyo nzu nini ikomeye harimo DNA. DNA ni biba.
The royal family, DNA, does not leave the castle.
ati DNA nta na rimwe igiva mu nzu yayo muri iyo nzu nini ikomeye.
And outside those castle walls is the bustling city itself.
Ati hari inyuma hari site, hari umujyi urimo ibindi bintu.
And they have things like a baker or a blacksmith and all the other jobs the city needs.
Ati harimo abantu bakora ibintu bikora nyine ibyo site yose ikeneye.
And the city itself is surrounded by fortified walls.
Ati kandi n'iyi site nayo ifite ibikuta binini cyane.
Then an outside messenger, mRNA, comes to the city, the cell.
Ati noneho rero rwa rukingo ruraje, mRNA iraje igeze harya ku rukuta rwa site.
The messenger comes to the blacksmith.
Ati bya yindi izanye inkuru igeze hahandi muri ba bakozi bandi.
The blacksmith is representing ribosomes. The things that make proteins.
Ati kiriya rero kiri cya blacksmith nyine nicyo kirimo protein.
Very good. And the messenger, the mRNA, says to the blacksmith, the ribosome, I have something I need you to make.
Ati noneho abandi baje nyine byaje bizana inkuru bikavuga ati hari ikintu ushaka gukora.
It's going to help your city, this thing that you're going to make.
Ati noneho birafasha iyi site ibindi bintu bigomba gukorwa.
It's going to protect it because a powerful enemy, COVID-19, is coming.
Ati ahangaha rero birashaka gufasha iyi site gukomera kubera ko COVID-19 iraje.
So the blacksmith looks at the messenger's plans.
Nuko iriya blacksmith kareba abandi bazanye inkuru.
The plan is to make spike proteins.
Hariya akazi ni ugushaka ukuntu nabo bakora proteine zikomeye.
The messenger never enters the castle or disturbs the royal family.
Urabona ko ziriya messenger zaje bariya batumwa baje ntabwo binjiye hariya hagati muri iriya site ikomeye muri iriya nzu ikomeye.
It has no need and it cannot get in anyway.
Kubera ko nta nubwo zishobora kugeraho nta nubwo zabishobora kandi nta nubwo bigomba kujyayo.
The messenger has completed its task. It has delivered the message.
Ubwo rero ziriya messenger uriya waje atumwe yamaze gutanga inkuru.
And so it quickly leaves the city.
Ikongera ikava muri site ikigendera.
Meaning that it is broken down and leaves the body.
Ni ukuvuga ko iyo yamaze gushwanyagurika ivuye mu mubiri.
The blacksmith takes this newly forged spike protein.
Ati rero ahangaha huzuye proteine hagatangira gutanga proteine.
And it takes it to the city guard.
Ikajyana kuri bariya basirikare noneho ba site.
The city guard is like our immune system.
Iyo rero niyo idukingira indwara.
It helps keep us healthy.
Iyo ngiyo niyo ituma tutarwara indwara zose.
The blacksmith tells the guard.
Ahangaha rero iriya blacksmith yuzuye proteine ikabwira ba basirikare bo mu mubiri wacu.
An invading army, COVID-19 is coming.
Ikababwira ati COVID-19 iraje mwa basirikare mwe mube mwiteguye.
The army wears these spikes on its armor.
Ati abasirikare nabo bagatangira kwambara turiya tuntu natwo tw'intambara nyine utuntu tuzirinda.
Study these spikes so that when you see them, you will know that they belong to the enemy.
Ati noneho wababona ukabona ko nabo bari kumwe namwe nyine bajya gusa nkamwe.
The city guard has a very good memory.
Kandi abo basirikare baba bafite mu mutwe hakora neza.
And when they see an invader wearing spikes, they rally the troops.
Ati iyo babonye ahantu hari ikintu kije kiza kibasanga kandi cyambaye iby'intambara nazo zizongera abasirikare.
Or activate other parts of the immune system.
Cyangwa se zikongera zikakoresha ibindi bintu bikingira umubiri wacu byinshi.
They defend the entire city, the cell.
Bakongera bakahagarara ku ndemangingo zacu bakazirwanirira.
And all the surrounding cities and cells, the body.
Kandi bakarwanira umubiri wacu wose.
And there have been global mass immunization campaigns in the past.
ati buri gihe habaye inkingo twese turabizi ko habaye inkingo kuva kera.
Smallpox is the very first one that comes to mind.
Ati buri gihe hari ukuntu bazana ibintu byo kuvuga ngo hari ukuntu zikorwa.
I remember as a young child asking my mother how she got such a funny looking scar on her arm.
Ati ndibuka nkiri umwana nabajije mama wanjye ngo kuki ufite ikintu cy'igikovu hano ku kaboko.
She would tell me that it was when she was vaccinated as a child.
Arambwira ati ni igihe bamutera urukingo ari umwana niyo mpamvu yagize icyo kintu. Twese abantu benshi muri 1980 ku isi yose batangiye gutera inkingo.
And that's because vaccinations work.
Kubera ko urumva ko inkingo zirakora.
But why does everybody need to be vaccinated?
So noneho ni iki gituma abantu bose bagomba guterwa izi nkingo?
Well, it's simply to protect those in the community who cannot be vaccinated.
Kugira ngo dukingire bariya badashobora kubona runo rukingo kubera kibibabuza.
Vaccines not only help safeguard you, they also shield other people.
Ntabwo ari wowe gusa uru rukingo rurinda, ahubwo rurinda n'abandi bari iruhande rwawe.
Like the neighbor's newborn baby who is too young to get the COVID vaccine.
Tuvuge nk'akabebe kakivuka kadashobora gufata urwo rukingo.
Or the grandmother getting chemotherapy for cancer.
Cyangwa se nk'umukecuru ugomba gufata chemotherapy urwaye kanseri.
It also helps protect the rare person who just doesn't mount an immune response or memory to a vaccination.
Cyangwa se undi muntu udashobora gufata urukingo kubera ko adafite gusa ibimukingira kuri urwo rukingo.
This is called herd immunity.
Ati ibingibi rero no kuvuga ko ari ibintu bituma tugira ukutarwara.
Each person vaccinated is like a brick in a wall defending the community at large.
Ati buri muntu wese utewe urukingo abakingira buri muntu uri muri ako gace kuri iyo ndwara.
And each unvaccinated person is a chink or a break in the wall and a gap in the defenses.
Ati rero utarutewe abameze nkaho ari umwobo mu rukuta kubera ko atuma bitagenda neza.
And those gaps allow the virus or a bacteria for other vaccines to get through those holes and infect those individuals who are not protected.
Urumva rero iyo myobo mu rukuta ishobora gutuma iyo virusi inyuramo ikagenda igatera abantu bose indwara bari iruhande rwe.
I have heard about generally healthy people getting sick on purpose to develop their own natural immunity.
Nigeze kumva ngo hari abantu bashaka kurwara ngo kugira ngo bagire izo mbaraga zo kutongera gufatwa n'iyo ndwara.
However, there are a few major flaws in that thinking.
Ariko urumva ko atari ibintu nyabyo, ndumva atari byo.
First, we cannot predict who will have severe disease.
Cyambere ntabwo dushobora kumenya nimba urwaye cyane cyangwa ufite iyo ndwara akomerewe.
Certainly, we can say if you have heart disease or diabetes, you are at greater risk.
Ati dushobora kuvuga ngo niba urwaye umutima cyangwa ufite diabete ushobora kubifatwa n'iyi ndwara kurusha abandi.
But we can't determine if the 20-year-old star athlete will have a stuffy nose or need a breathing machine.
Ati ariko ntabwo dushobora kumenya niba umukinnyi w'umupira ukomeye cyane ashobora gukenera nawe ko bamuha imashini zo guhumeka.
Number 2,
Cya kabiri,
you can be an asymptomatic carrier.
ushobora kuba ufite iyo ndwara ari uyifite ariko bitagaragara.
Meaning that you can be infected and contagious without showing any symptoms.
Ushobora gutera abandi indwara ariko uterekana ko uyifite.
Especially those first few days of illness.
Cyane cyane muri iyo minsi ya mbere ufashwe n'indwara.
Which means if you are actively trying to get sick and you succeed, then oops, you just spread the disease to great grandma.
Urumva niba washatse kwirwaza iyo ndwara ukaba wabishoboye kubigira ariko muri ako kanya bigitangira umaze gutera nyogokuru wawe iya ndwara.
Before you even realized you were sick.
Kubera ko utaramenya ko narwaye.
Number 3.
Icya gatatu,
We don't know how long immunity lasts following infection.
nta nubwo tuzi niba kugira izo mbaraga zo kurwanya indwara bimara igihe kingana gite kugira ngo utarwara iyo ndwara.
Based on the data we have currently, it seems like immunity after infection lasts only 3 months.
biragaragaza ko iyo umaze kurwara iyo ndwara n'imbaraga uba ufite zo kurwanya iyo ndwara bishobora kumara gusa amezi 3.
And there have been many reports of people getting reinfected.
Ati kandi tumaze kubona inkuru nyinshi kuko hari abantu bongera bakarwara ya ndwara.
Meaning, even if you have gotten the COVID infection, you still need to get the vaccine to protect you with longer lasting immunity.
Niba wararwaye iyo ndwara ugomba gufata vaccine yawe kubera ko ugomba kugira igihe kirekire cyo kurwanya iyo ndwara.
Number 4.
Icyakane.
For herd immunity to work, it requires 70 to 90% of the population to have immunity.
Kugira ngo izo mbaraga zo kurwanya indwara zikomere nuko 70% igomba kuba yarabonye urukingo.
Scientists are thinking that COVID will be closer to 70%.
Abizi science baravuga ngo kuri COVID-19 ho bigomba 70% bafashe urukingo.
So let's do some math.
Reka dukore imibare.
The United States population has 328 million people.
Muri Amerika hari miliyoni 368 z'abantu.
70% of the US population would be 229 million people.
70% y'izo miliyoni biraba miliyoni 228.
The average COVID mortality rate for the United States for all ages is about 3%.
Ni 3%.
So if you multiply 229 million times 3%, that equals 6.9 million.
Ati ni ufata za miliyoni 228 kuba 3%, urabona 6.9 miliyoni 6.9.
Yes, million.
Million.
That many million Americans could die to achieve the theoretical herd immunity without a vaccine.
Ati izo miliyoni z'abanyamerika zishobora gupfa kubera ko zabuze urwo rukingo.
And remember, immunity without the vaccine wanes very quickly.
Kandi kugira izo mbaraga zo gukingira umubiri wawe kubera ko warwaye iyo ndwara zimara akanya gato cyane.
So to put that number in perspective, that is the entire population of Missouri.
Tushyize uwo mubare mu buryo dutekereza abantu bose ba Missouri baba bapfuye.
Gone.
Baba bapfuye.
And that does not include the millions and millions of lives affected.
Kandi ubwo ntabwo dushobora kuvuga n'abandi basigaye kandi bagifite iyo ndwara.
Yes, the countless family and friends of that loved one who died.
Kandi nabo bose bafite agahinda k'ababo bagiye.
That is why I recommend that everyone who is able to get the vaccine when it is offered to them, get it.
Niyo mpamvu mbasaba buri wese uzagira akanya ko gufata urukingo azarufate.
Currently, it is being offered in a tiered approach.
Urabona barimo baragenda barutanga ariko birimo biraza.
Those at higher risk get the vaccine first because of their age, where they work or live.
Abakuze cyane, abaganga cyangwa abandi bose naho ukora bishobora gutuma ubona urukingo bwa mbere.
Or their underlying health conditions.
Cyangwa se abantu bafite ubuzima budashobotse barwaragurika.
Things like cancer, heart disease, lung disease.
Abarwara kanseri, umutima cyangwa bakarwara impyiko cyangwa ibihaha.
For example.
Ibyo nibyo twashobora kuvuga.
And then the general public.
N'abandi bantu rero basanzwe abantu bose.
At present, the vaccine has not been evaluated in children.
Urukingo ntabwo bari barupimira ku bana bato.
It may become available to children as early as next year.
Wenda umwaka utaha abana nabo bazatangira kuruterwa.
Pregnant women and nursing mothers were not directly studied in the vaccine trials.
Abamama batwite cyangwa se abo bandi bashobora gufata urukingo nabo.
So there is no clear yes or no answer.
Ahangaha ntabwo turamenya niba ari byo cyangwa atari byo ariko hari ikintu kikigwa.
However, based on other vaccines and other mRNA medicines, it should be safe to those women.
ati ariko iyi miti ntabwo ari mibi nayo yaba myiza kuri abo bagore batwite.
I also know several pregnant or breastfeeding fellow doctors and nurses who got the vaccine.
Ati nzi abagangakazi bamaze gufata uru rukingo.
There are those who should not be vaccinated because they have a severe allergy to an ingredient in the vaccine.
Ati hari abo babwira ati ntabwo ushobora gufata uru rukingo kubera ko hari ukuntu ufite ibintu bituma bitagendana n'uru rukingo.
For example, if you have a very severe allergy to the medicine called Miralax, you should not get the vaccine.
Ati niba ufite ukuntu Miralax igutera ibibazo ntabwo wakagombye gufata uru rukingo rwa COVID-19.
That may change based on other vaccines that are coming out in the near future.
Ati ariko bishobora guhinduka kubera ko baracyakora izindi vaccine zizaza, izindi nkingo zirakigwa zirimo ziraza.
And as a reminder, it is very common to get fever, body aches, and headaches after getting any vaccine.
Ati rero iyo umaze gufata urukingo urwo ari rwo rwose ushobora kugira akariro gakeya, kubabara, ukababara ingingo, ibyo birasanzwe.
And the COVID vaccine is no exception.
Rero na COVID-19 iyi COVID-19 nayo ntaho bitandukanye n'izindi.
Those symptoms are an indication that your body is recognizing the vaccine and developing an immune memory.
Ati rero ibyo bintu bikubaho, ubwo bubabare butuma umubiri wumva ko umubiri urimo kumva wa muti winjiye kandi ko birimo kugufasha kwikingira.
You cannot get infected from the vaccine because it does not contain any of the virus.
Ntabwo iyi vaccine uru rukingo rurimo ikintu na kimwe gihuye na virus.
Yes. While the symptoms can be uncomfortable, they are a good thing because the immune system is doing its job.
Ati nubwo hari abumva bababaye cyane ariko urumva umaze gufata uru rukingo ukagira ububabare ni ukuvuga ko babasirikare na bya bindi bikurinda birimo gukora neza.
I would never recommend a vaccine that I was not willing to get myself.
Ntabwo nababwira ngo mufate urukingo nanjye njye ntarufata.
I got the Pfizer vaccine.
We yafashe Pfizer vaccine.
But I would have happily gotten the Moderna vaccine if that was what was available to me.
Ariko niyo bamuha Moderna yari kuba nziza. We yafashe Pfizer, njye nafashe Moderna. Ejo nzafata urukingo rwanjye rwa kabiri rwa Moderna. Urumva twafashe inkingo zitandukanye kandi turi.
Now, let's dispel some myths and tackle some untruths we've heard about the vaccine.
Reka noneho tuvuge ku bintu barimo kuvuga bitari ukuri kubyerekeye uru rukingo.
So the COVID vaccine does not alter your DNA.
COVID-19 ntabwo igenda ngo igire aho DNA yawe ituye. Hahandi batweretse hagati hariya.
The mRNA material in the vaccine does not enter the nucleus.
Ati merene iri muri urwo rukingo ntabwo igenda ngo yinjire hariya aho batubwiye muri ziriya nkuta.
Just like the messenger mRNA, or just like the messenger didn't go into the castle and interrupt the royal family.
Akuriya buriya butumwa bwaje kubera urukingo wabonye utagiye ngo rwinjire hariya muri yanzi ikomeye aho DNA iba.
The COVID vaccine does not contain a microchip.
Urumva kandi COVID-19 ntabwo irimo za chip batubwira.
But your smartphone and tablet do.
Ariko ziriya telefone birimo na hariya muri za computer birimo.
Online is where you should be careful.
Ahubwo twakombye kwitondera ibyo dukoresha no kujya ku mirongo aho duhora.
The COVID vaccine is not the government or big drug companies trying to harm you.
Ntabwo ari ukuvuga ngo guverinoma cyangwa se hari abantu bari inyuma ya guverinoma bashaka kubababaza kubera uru rukingo.
The government has much more interest in making sure its citizens are as healthy and capable as those individuals are able.
Ati ahubwo guverinoma irifuza ko twese twakingirwa, twese nabo bagakingirwa, twese tugakomera.
The COVID vaccine does not contain cells from aborted babies.
Kandi iyi COVID-19 ntabwo irimo bya bindi bavuga ngo ni abana b'impinja bagiye bica bagashyira muri urwo rukingo.
While human cell lines were used very early on in the laboratory testing process,
kandi uru rukingo runyura ahantu henshi muri za laboratoire barabireba bakarukorera amateste bakamenya ko hari icyo rwamara.
There were no human cells used in the making or manufacturing of the vaccine.
Nta kintu na kimwe gituruka ku muntu cyangwa gituruka mu muntu cyakoreshejwe uru rukingo.
Those cell lines originated decades and decades and decades ago.
Rero urumva ibi byose byakozwe kuva mbere na mbere na kera.
No new cells were used.
Nta kintu gishyashya cy'indemabugingo kirimo.
And those original cells have been kept growing in a laboratory ever since.
Ati kandi ibyo byose babishyize muri laboratoire babirebera muri laboratoire kuva mbere.
Yes, and again, there were no fetal cells in the vaccine being administered to people.
Ati nta kintu na kimwe kiri muri iyi vaccine cyangwa muri uru rukingo cyo kugira ngo gishobore kubabaza umuntu.
The COVID vaccine did not cut corners in quality.
Ati COVID-19 ntabwo ari ikintu bapfuye gufata gusa ngo ni cyiza.
What did get cut was bureaucracy.
Ati cyabaye nuko byagombye ubwumvikane.
Pharmaceutical research companies have been studying other forms of the coronavirus for decades.
Ati farumasi nyinshi zakomeje kwiga kuri iki kibazo cya coronavirus kuva kera.
And mRNA technology has been used in other applications, which gave these companies a jump start.
Ati na iyi kintu bakoresha cyitwa mRNA kiri muri urwo rukingo cyakozwe kuva kera ariko nicyo bavuze bati reka dukoreshe.
Very precious time was saved because the laboratories weren't having to grow virus for antigens.
Rero icyatumye badakoresha mikorobe z'iyo ndwara nuko bibafata igihe kirekire kugira ngo babashe kubyiga bagombye kubikora vuba vuba.
Instead opting to use mRNA.
Ahubwo baravuze ati dukoreshe mRNA dufite.
Many steps like the phase 1, 2, and 3 trials.
Icyo gihe bagerageza bagiye ku gice cya mbere cya kabiri n'icya gatatu.
Were all done in parallel instead of sequentially.
Byabaye ibintu bikorwa vuba vuba kandi bikurikiranye aho kugira ngo bagende bakurikira ibihe n'ibihe.
The time waiting to raise funds between each step and the financial risk was eliminated because of serious monetary backing.
Urumva ntabwo bashoboye gukoresha amafaranga menshi kubera ko ni ibintu byari gukurikirana kandi vuba vuba bari bakoresheje.
These actions saved a lot of time, but without sacrificing quality or safety.
Ati yego wenda byakozwe vuba vuba ariko ntabwo ari ibintu byakozwe mu bintu by'ubusa.
The COVID-19 vaccine is not the mark of the beast or a sign of the Antichrist.
Ati ahangaha baravuga ngo ni Antichrist muri urwo rukingo urimo. Ntabwo ari byo.
1 and 2 John describe the Antichrist as someone or something that is the total opposite of Christ Jesus.
Ati ubundi muri Yohane baravuga ngo Antichrist ni abantu badagira aho bahurira na Yesu.
Something that is truly evil.
Ati ibintu by'umwanda by'amashitani.
The vaccine, the scientist, and even the coronavirus itself cannot be the very embodiment of evil.
Urumva ati rero uru rukingo n'ibyo byose ntabwo bashobora kubikoresha ibintu bitajyanye na Kristo cyangwa bigira icyo bizana na Kristo.
The beast is thought to be a historical reference to the tyrant Emperor Nero.
Ati rero iyo nyamaswa ubundi ni ikintu cyavuzwe kuva kera.
Who viciously martyred many Christians in the ancient Roman Empire.
Ati yari umuntu wishe abantu benshi mu Romani bwa kera.
The mark appears on the hand or the forehead.
Ati kandi ikimenyetso cyawo kiba hano ku kaboko cyangwa hano ku mutwe imbere ku mutwe.
The vaccine is given in the shoulder.
Ariko urukingo bararuduha hano ku kaboko.
So that does not match up either.
Ndumva ko bidahuye na ya nyamaswa bavuga.
These are all conspiracy theories.
Ati ibintu byose ni ibintu bahimba.
They are simply not true and not founded in any fact.
Ati ni ibintu bidafite naho bishingiye nta naho turabibona.
It is never wrong to ask questions.
Ntabwo ari bibi kubaza ibibazo.
Questions are good.
Ni byiza kubaza.
It is how we learn and discover new things.
Ariko ukuntu twiga ibintu n'ukuntu tubona ibishyashya nicyo cyangombwa.
God made us curious for a reason.
Ati Imana yatumye tugira gushaka kumenya.
And it is our job as Christians to seek truth in all places.
kandi twebwe abakristo twagombye gushakisha ukuri muri buri kintu.
That is why we need to be very careful not to promote conspiracy theories.
Ati niyo mpamvu abakristo twagombye guhagarika iki kintu cyo kugira ibintu twiremera twenyine,
Because it can undermine our testimony.
kubera ko ni ibintu bibi cyane bishobora kwica ibyo twakavuze Imana yadukoreye.
If you have questions, then please ask.
Niba ufite ikibazo baza
Ask me,
baza abadogiteri nka Boni,
ask your doctor,
baza umudogiteri wawe se ukuvura,
look on trusted websites,
reba ahantu mu ma website nyine ureba ahantu bikubwira ibyo ari byo.
those based on a university or a medical school generally have good information.
Ati cyane cyane ama university cyangwa se abantu bize ubuganga nibo bafite igisubizo kuri ibi bibazo byanyu.
I like the Children's Hospital of Philadelphia,
Ati ngiye nkunda aho abana bavurirwa muri Philadelphia,
also called CHOP, C-H-O-P for short,
ati ni CHOP aho hantu rero,
or the Mayo Clinic.
cyangwa Mayo Clinic.
They have reliable information.
Ati abo bantu bafite information, bafite ibyo batubwira kuri ibi bintu byose.
Now we are still learning many things,
Ati ubu turakiga ibintu byinshi.
and there are still some unknowns about the COVID vaccine.
Ati kandi hari ibintu nanone bidasobanutse muri uru rukingo rwa COVID-19.
We don't know how long vaccine immunity lasts.
Ntabwo tuzi ukuntu kwikingira urwo rukingo ruzadukingira n'igihe ruzadukingira.
Illness-induced immunity seems to last about 3 months.
Ati iyo warwaye COVID rero ushobora kugira kwikingira nk'amezi 3 gusa.
Those individuals in the research trials have shown immunity for longer than that so far.
Ati ariko abantu batewe uru rukingo bamaze kwerekana ko bashobora gukingirwa nyine igihe kirekire.
But we don't yet know if this is a vaccine that will need a yearly administration like the flu shot,
Ariko ntabwo tuzi niba uru rukingo ari buri mwaka tuzajya turufata nk'urwa flu,
or once every 5 to 10 years like tetanus or lockjaw,
cyangwa se imyaka 5 ku 10 nk'urwa tetanus,
or if it will be somewhere in between.
cyangwa se wenda hagati aho ngaho amezi make tukongera tukakingirwa.
We are still determining if the vaccine completely prevents illness like the measles vaccine,
Ati ubu baracyareba niba uru rukingo rushobora koko gukingira nka za ngingo bakoreze za measles,
or tempers disease where you don't get as sick,
cyangwa se igihe gito kugira ngo utongera kurwara,
where you don't need to be hospitalized
cyangwa se ukaba utajya mu bitaro kubera ko warubonye,
or have long-lasting side effects from the illness.
cyangwa se ntugire bya bibazo by'indwara itera igihe kirekire.
This would be similar in design to our current flu vaccine.
Ati mbese nka kurya kwa flu, rura rukingo rwa flu rumera n'ukuntu rukora.
If it is the second, then it is still possible to pass the infection on to someone else.
Ati urumva utarutewe washobora gutera abandi indwara.
That is why it will still be important to wear a mask when in public.
Cyangwa se ukaba wararutewe ukaba watera n'abandi. Niyo mpamvu tugomba kongera tukambara ziriya mask nubwo twabonye urukingo.
I am very anxious to not have to wear a mask anymore.
Jewe numva mfite ubwoba bwo kutambara iyo mask.
I miss seeing people's smiles.
Ati kandi numva mbabajwe nuko abantu ntakibona uko basekera.
Although I am getting very good at reading eyebrow expressions.
Ati ariko ntacyo dukoresha amaso kugira ngo werekane ko wishimiye umuntu cyangwa utamwishimiye.
But we need to continue to be patient and vigilant.
Ariko twagombye gukomeza kwihangana no gukomeza gukora ibyo tugomba gukora.
As we find an answer.
Kugira ngo kugeza igihe tuzabonera igisubizo nyacyo.
And hopefully that answer will come in the next few months.
Kandi ndatekereza ko icyo gisubizo kizaza mu minsi iri imbere.
And in conclusion,
Reka turangize tuvuga ngo
Ephesians 4:16 tells us that God made the whole body to fit together perfectly.
mu Efesayo 4:16 haravuga ngo muri Kristo niho umubiri wose uteranywa neza ugafatanywa nuko ingingo zose zigirirana nuko igice cyose gikora umurimo wacyo neza nta
Yeah.
kibazo.
As each part does its own special work, it helps the other parts grow so the whole body is healthy and growing and full of love.
Nk'uko buri gice gikora umurimo cyagenewe, niyo mpamvu nyine ibyo byose bikorana kugira ngo umubiri wacu ukomere.
For almost an entire year, we have been held captive by the novel coronavirus.
Hashize umwaka wose twarafashwe n'iki cyorezo cyaratubujije amahoro.
For those of us who have been praying fervently for a miracle, this is it.
Ati ba bandi basengeraga ibintu byitwa miracle cyangwa kuvuga ngo ikizaba Imana izadukorera, dore ngiki Imana yagikoze.
Just because a miracle arrives in an unexpected package doesn't make the miracle's origin any less divine.
Kubera ko igitangaza cyaje mu nzira zoroheje cyangwa se mu nzira za vuba, ntabwo bivuga ko iki gitangaza kitaturuka ku Mana.
I hope you have found this video helpful and
Nizeye ko iyi video yababereye nziza,
and I hope it relieved some concerns that you had
kandi nizeye ko habaye igisubizo ku bibazo byanyu mufite,
and answered some of your questions.
kandi yasubije byose ibyo ibibazo dufite.
Thank you so very much for your time and your attention.
Mwakoze cyane gukurikira.
Thank you.
Thank you. Thank you.